type 1 diabetes is one of the most common chronic diseases in children. But a new analysis by the World Health Organization shows that Africa topped the world in undiagnosed diabetes. Those diagnosed with type 1 diabetes need daily injections of insulin to survive and keep their blood glucose within acceptable levels. GH1's Nadima Uman Uthman reports that lack of affordable and timely access to medications such as insulin, poor access to health facilities, and lack of awareness continues to hinder effective diabetes management.
22-year-old Solis Anani was diagnosed with type 1 diabetes 16 years ago. Her pancreas, an important organ in the body which controls blood sugar levels, stopped functioning when she was 6 years old. Her parents noticed her plight when she frequently wet her bed while losing weight, despite having a healthy appetite.
I get chest pain and I'll be sweating, drinking a lot of water, urinating. Yes, that's my high sugar. With my low sugar, I will vomit the whole day and just be dizzy. There was a time I was writing exam. I had low sugar around 4 a.m. The paper was supposed to start around 8. I wasn't waking up. My friend came to the whole session, was like, we have paper. And I was like, oh, go, I'll come around.
Solis recalls how she learned to inject herself, count carbohydrates, and monitor her blood sugar levels when she was barely 10 years old.
When you are injecting and you keep repeating the same spot for injection, it turns to another complication. Yes, for instance, I think I have a complication. I had a complication here. So I think I was over-injecting re-injecting that side, and it actually tissued and it became a boil.
The missing insulin from her body needs to be replaced with injections or with an insulin pump. This means injecting herself about 6 times a day. The constant prickling of different parts of her body has had its own physical and psychological effects. For persons like Solis, access to affordable and timely insulin is a major hurdle they face. Though reforms are underway in developed countries like the United States, insulin costs are still quite high for many people with diabetes. But in developing countries like Ghana, where there is a double burden of diseases, non-communicable diseases such as diabetes do not receive the required attention. A vial of insulin costs around 150 to 250 cedis, which is currently not on the National Health Insurance Scheme and lasts less than 2 weeks.
I've been the only one doing my parents' money. All the time I have to call, Daddy, I need, even with the syringes for the injection, you have to buy it. I'll call him, I need syringe, I need insulin, and maybe I need strips for my test checking. And sometimes he gets bored because you call him every 2 weeks, so I need money. Yes, it was really difficult for him. And mommy too, sometimes she will just be like, she's tired.
The exact cause of type 1 diabetes is unknown, but in most cases, the body's immune system, which normally fights harmful bacteria and viruses, mistakenly destroys insulin-producing cells in the pancreas. According to the International Diabetes Federation, IDF, almost 200,000 new cases of diabetes are recorded in children up to 19 years each year in Africa. The IDF is predicting a rise in the number of persons with diabetes in Africa from 24 million to 55 million by 2045. Senior specialist and head of adolescent care at the Greater Accra Regional Hospital, Dr. Elizabeth Banka, says type 1 and 2 diabetes have become a public health concern.
It's something that has become a matter of public health concern, not just in Ghana, but then globally. And we've also seen that even in developing countries, to low to middle income countries, we are seeing that now we have what we call the double burden of disease. So you have the infectious disease coming up, infectious disease or communicable diseases, and then have non-communicable disease, which is diabetes and hypertension. And these are burdens that are going to be breaking economies. Yeah.
Weight gain, especially in the form of belly fat, as is often observed in obesity, is a risk factor for type 2 diabetes. Dr. Banka is worried about the continuous sedimentary lifestyle of the adolescent population.
In the schools, a lot of physical education or PE has become an afterthought, because we are focusing so much on academics. And I always tell my parents, we spend so much money to send our children to the best schools so they can get the best jobs, so they can get the best medicine for the diseases we give them. Because, we are so focused on academics, and our kids are doing screen time all the time. They are putting on weight. They are developing type 1 diabetes. Yes, they'll go to the best schools. Yes, they'll get the best jobs. Yes, they'll get the best, they'll get money. Then they can buy the best medicines.
As Ghanaians are advised to adapt to exercising more, drinking lots of water and avoiding frequent alcohol intake and regularly getting screened, persons like Soleil's Hope Insulin, which serves as a major lifeline for diabetes, can be put on the National Health Insurance Scheme. Reporting for GH1 News, I am Nadima Omar Uthman.